Hello and welcome to The Scramble. I'm UNLV-TV. Today we dig into the disturbing allegations of abuse made by patients of Desert Regional Center and their families. Desert Regional Center is a state-run facility providing care to Las Vegas residents with intellectual disabilities, and I'm so happy to be joined by the lead investigative reporter on this case, Nathan Baca, with the I-Team at 8 News Now.
Thank you.
Thank you very much for joining us. Before we dig into this topic, I would like to introduce the panelists. We have with us today Tommy Laren. You are majoring in News and Media Studies. Happy to have you back. Jenny Leese, a graduate student in News and Media Studies as well. And I'm happy to introduce a new panelist today. We're breaking you in pretty early, aren't we?
That's right.
This is Ryan Hamilton. Tell us a little bit about yourself.
My name's Ryan Hamilton. I'm a second-year graduate student in the Journalism and Media Studies program. My thesis research primarily focuses on the election of 1800, the use of a particular type of media called a broadside in election rhetoric. That's pretty much it.
That sounds a little complicated.
It's very boring, actually.
Welcome to the show. Thank you all for being on the show today. So I'll start us off with a kind of a general question for you. With these allegations, how did this come to light? How did you get started on this?
Pictures just tell so much of a story. So when we had a local attorney, Adam Graff, send us some pictures, and families were sending us pictures of some severely autistic men who were coming in with severe injuries at Desert Regional Center, the state facility for mental disabilities and also mental injuries. We're talking severe autism, we're talking traumatic brain injury. These pictures are showing men with black eyes, with chipped teeth, bloodied faces, deep lacerations. And the question, of course, has arisen like, how is this happening? The families, and indeed when we went in to talk to some of these patients, were saying that they were being caused, in effect, by a fight club that was happening between these patients that was instigated, according to them, by staff members, by orderlies there that are supposed to, of course, be protecting them and watching over them. And Desert Regional Center completely denies that this is happening. They are saying instead that what happens often is that these patients are injuring themselves. So it brings up the question, what is, at the very least, the state cannot prevent these patients from injuring themselves and causing major injuries. At the most, what is happening, if the family's allegations are true, then you have a situation where you have violence happening at this location.
Ooh, and indeed it seems that these pictures really do say a lot about the conditions there, and something obviously seems to be going on. I'd like to turn it over to some of my panelists here to ask you a few questions. Tell me, would you like to start?
Absolutely. Well, my first question would be, ultimately, who needs to be held accountable for something in a he said, she said type of situation? How do we hold somebody accountable?
Well, the state has done reviews. They have done audits of the situation, and those state audits so far through the Division of Mental Health have showed that the claims cannot be substantiated to the families because it is, like you said, a he said type of situation. But what Congresswoman Dina Titus has called for is an independent review, somebody to come in from the outside and look at the situation, maybe some mental health professionals, and also a creation of an ombudsman position. Because many times these families don't know who to turn to, and they turn to the supervisors, admittedly, of these same type of situation. The supervisor, though, in many cases, part of their job is to maintain to keep the status quo going forward, to basically keep the institution going forward. An ombudsman, such as what they have for the Division of Aging, many times can look into what is happening, can be an advocate for the family. They have one for the aging, but they don't have one for mental health here in Nevada.
To jump in real quick, how did Dina Titus get involved? Was it your report that...
Dina Titus watched our report, and you know, it brings up kind of a shocking situation where you're kind of like, you know, what is happening? And some other constituents contacted her saying, you know, like, what are you going to do about this? Because whereas it is a state funded location, you have a situation where it's also federally funded as well. They receive federal grants. So Congressman Titus is concerned enough to write a letter to Health Director Mike Wilden and really get a situation of what is going on, calling for truly independent investigation.
So really putting some pressure.
Yes.
Focus.
Sure.
Focus on it. right?
My question is, did you approach it with any skepticism given the fact that the family's attorney approached you? I mean, if there were to be any kind of suit, he would be, liable to take in at 1/3 to 1/2 if it went to trial. It seems to me that if you were to follow the money, there's only one party that seems to benefit from this, particularly when you're weighing issues of credibility, and that's the attorney. So.
Yeah, certainly. And, the attorney at the first part was actually not representing some of the families, but ultimately is representing all three of the families that are currently alleging abuse. When you certainly, you approach this story, and you certainly have to have like kind of that question of who does stand to benefit. The documents, the health documents that really kind of come into play, and also the pictures. But the question is of itself, are those patients injuring themselves? Once you talk to some of these patients, as we have, there are two situations that can either exist. Either one, the patients are lying, which is definitely a possibility. The patients could very well be lying and creating a construct of what is happening there. Just not only due to the nature of their conditions, it is difficult for a person with those type of mental disabilities to continue some sort of elaborate lie type of situation. It's very difficult. And we were noticing that the stories were not only consistent on two patients, but indeed the third patient that we just actually contacted said that he witnessed the other two, one of the other incidents. So we actually kind of have like some cross examination, so to speak, of what's been happening.
Wow. That is something when you're dealing, especially with patients that are severely intellectually disabled. It's interesting to see how that lines up. I've seen some of the interviews. I'll let Jenny go ahead.
Yeah, I'm very curious about the investigation in this, because I believe you went undercover for a number of months, and especially since the patients aren't supposed to see people that are not family members. So how did that work out exactly? Well,
the family members at different times have limited abilities to actually visit their children, their adult children. These men are in their 20s. But depending on their adult children's behavior, they have limitations placed on it. We sent in our photojournalist, Alex Brower, to go in with one of the family members with, of course, the family's permission, to shoot an interview with one of the people. His name was Jacob Bluel, to talk to him about what his situation was. And again, what we were hearing from him matched up with what the others were saying. But as far as getting that access, because what is happening as well is, admittedly, Desert Regional Center cannot comment on specific patients because of HIPAA, a law that basically prevents the state from commenting on specific people's medical records. However, they can comment on general practices, and we can also request and indeed demand specific documents as we've been receiving now.
Interrupt for just a moment. We're going to have to take a short break, but when we come back, I'd like to follow up a little bit more on this undercover investigation. How that you got to prove to do that, because that's a
sure.
We'll be right back.
Winston, just one more inning, Grandma.
Ever notice how many things today kids can do without actually moving? A whole lot of things their parents used to do the hard way. So many kids' activities today seem to leave out the activity part, which makes exercise even more important for children. In fact, new research tells us the best time to enhance bone development is during childhood and adolescence. And just getting children to walk an extra 35 minutes a day could spare them the pain of thinning bones later in life. Healthy bones come from healthy habits. Encourage your kids to get up, get out, and get moving.
Hello. Hey, Grandma, how about another grape soda?
A public service message on building strong bones for kids from the Pediatric Orthopedic Society of North America and the American Academy of Orthopedic Surgeons.
At what age is the color that your skin was meant to be no longer beautiful? Every year, millions of young women try to change the skin they were born with and say they die for darker skin. Sadly, some actually do. Melanoma is the second most common cancer in teens and young adults, and one person dies from melanoma every hour. Change your thinking, not your skin. Stop tanning. Learn more at spotskincancer.org. A message from the American Academy of Dermatology.
Welcome back from the break. We are joined by Nathan Baca of 8 News Now's I-Team, talking about the abuse allegations that are happening in Desert Regional with the mentally disabled there. Jenny was bringing up the undercover aspect of this. To roll it back a little bit, how did you decide that this, journalistically even, that this is something that warranted going undercover?
Well, you know, we sent our photojournalist Alex Brower out into that location with the family to be able to get word from the actual patient, because it's one thing to talk to a family member who has heard it from their beloved son or daughter, because they do have women there too, but it's another thing to actually hear it from the patient themselves. And we needed to really get an idea of whether or not that patient was going to tell a consistent story. And the same thing that what we did with Mike Hicks as well, the third patient, because you can get a situation journalistically where if you know, the patient's telling a slightly different story, if the family members are basically embellishing it in some way, that can create a situation.
Right. Jenny, you had a question. We were talking up a storm during the break, right? Say it for the show. Go ahead.
Tommy. We're both blonde, so you get us confused.
Call you Jenny again?
That's okay. I was just going to ask you about a possible chilling effect that might occur with the visitation. I know you said afterwards, were there any repercussions that you noticed because they did talk to the investigative team?
Well, the family members did tell us after that regarding the family members, Oscar Morales and Jacob Blue, the first two parents that talked to us, the first two families, they were saying that there were restrictions placed upon seeing their loved ones after our stories aired. Now, Desert Regional Center says that's because of basically behavior changes within those two men. So it does kind of bring into highlight that it is a very closed environment. Now, Desert Regional Center would argue that's because it's for their own safety, it's for their own health. But the parents are saying, you know, if you are disconnecting us from the outside, disconnecting them from the outside world, we have no ability to really, even take in some of these abuse complaints because we're not even able to talk to our own loved ones.
Right, they're isolated.
Yes.
Even at the same time, it's problematic for patients that are seeing others step forward and voice their stories, and if their parental visits get cut off, they may think I should keep quiet. So benefits that I may get, free time or visitation with family members may be cut short as well if they were to speak out.
And you also get a situation where the families are just kind of wondering, should we take our children out of this situation? But again, it's the only location in Nevada, so the only option really is to move them to a different state.
What are the allegations? I mean, forgive me. On one hand, we have a fight club ring set up in a mental institution by employees of the state in which supervisors are complicit, right? That's difficult for me to believe, particularly because I've had firsthand experience working with the severely, profoundly intellectually disabled who do injure themselves in ways that are shocking to the conscience, right? So you have the one hand, you have this fight club ring, and then on the other hand, you have the possibility of leading questions, ideas planted by the parents, this attorney who seems to be representing all three of them, which I think is incredibly unethical, inconvenient for him, right? So how are we supposed to weigh these issues, particularly given that the state has no ability to comment? I mean, they might have information that suggests that parents are leading on the adult children in the facility, right?
So when we look at some of the documents that are brought forward by the state, you start noticing some inconsistent paperwork. We were noticing, now is it a smoking gun? No. But the inconsistent paperwork is this. When you have, on one hand, one report stating that there's patient-on-patient violence, that one patient is attacking another patient. The allegation by the family was that it was, and the patients themselves, so that was part of the fight club. And then another report detailing that same exact day of that patient saying that it was actually the patient hitting his own head.
Let's take another short break.
Sure.
I'm very sorry. When we come back, I want you to finish your point.
By all means.
Please stay with us. We'll be right back.
Think you found every hazard out here today? Think again. The spot you missed could be a killer. That spot on your skin could be skin cancer. Fact is, if you're a man over 50, you're in a group most likely to develop skin cancer, including melanoma, the kind that kills one person every hour. 1 in 5 Americans is likely to develop a form of skin cancer during their lifetime. That's why your best shot is to check for a spot. It's easy. Follow through and check your skin. It could be the save of a lifetime. Go to spotskincancer.org to find out how. A message from the American Academy of Dermatology.
So many kids' activities today seem to leave out the activity part. New research tells us that just getting children to walk an extra 35 minutes a day could spare them the pain of thinning bones later in life. Encourage your kids to get up, get out, and get moving.
Hello. Hey, Grandma, how about another grape soda?
A public service message on building strong bones for kids from the Pediatric Orthopedic Society of North America and the American Academy of Orthopedic Surgeons.
Welcome back. I'm sorry to interrupt you on the other side of this. Ryan was bringing up the point that there, how do you measure the validity when there may in fact be, monetary interest in this from the part of the allegations?
And before the break, we were talking a little bit about the bookkeeping situation, but that may just be, it's a large state agency, maybe the bookkeeping is not correct. But as far as whenever we had Alex Brower, our photojournalist, go into that situation, he was asking kind of multiple probing questions to try to figure out whether or not Jacob, in this instance, Jacob Blewell, would change his story. We did the same thing with Mike Hicks as well whenever we talked to him, because it is, in my opinion, it is difficult for a person of that mental capacity to keep an elaborate lying story together. It's hard enough for us to do so with high mental capacities. It's much more difficult for a person to be able to do that whenever they have a lower mental capacity due to traumatic brain injury.
And also on that, I mean, you're seeing the same names coming up in police reports, like Harry Daniels. As he's the one that is that the patients are saying that he's the one that's hitting them, that's abusing them. And these aren't, small cuts or bruises. I mean, these are severe gashes. These are chipped teeth. I mean, really dark black eyes.
Yeah, when we start noticing that the 2 police reports, both from the same residential unit, both involving one common name, Harry Daniels, who has not been found guilty in any case. He has pending discipline, according right now to Desert Regional Center. We're also potentially hearing of 2 other people that may also be under some sort of suspension at this point. But it gets to these patterns of why are we noticing the same building? Why are we starting to notice the same names? What is truly going on there? Has there just been a loss of control, or has there been something worse going on there?
Because plus, from an internal perspective, I mean, it's difficult because, these patients, they're mentally disabled, so it's easy to say, anything that they're saying just, gets thrown out. They're crazy. They're making things up, But as you were saying, when you're getting these same stories repeated over, it's it makes you feel quite uncomfortable how the system can kind of sweep some of these things under the rug, or hopefully it's with your investigation and with this going forward, we can bring to light these issues.
And there have been changes. I mean, the Desert Regional Center has now done some policy changes to try to make it a little bit more independent. They are now bringing in Metro Police's abuse and neglect unit in every single investigation. They didn't previously do that before. They are asking for, it's the proverbial money situation. They're asking for more money to bring up staffing levels, because they believe that if they do that, then they'll be able to, have more eyes, more supervision. One can cynically, say that, well, this is just because, they want more money, but one can also say that the staffing ratios arguably are too low at places like Desert Regional Center.
But if they are abusing their patients or they're egging them on into fight clubs, what aspect does money really play into that? If you have unethical behavior, what does throwing more money at the issue do for it?
And that is always like the open-ended question. One can argue that within any organization you have like a bad apple or what have you, but you may have a situation where now, under this new policy, you will have a supervisor now kind of going building by building, random checks more often. But does that take that supervisor away from other duties? And therefore, can they now use, kind of spreading jam too thin on a piece of bread on toast? You kind of wonder, like, okay, like where are we going to get more to be able to cover that same amount of ground, especially with the demand for these services going up?
It doesn't strike me as a high task to find people to work at a mental hospital who aren't going to organize fight clubs. I mean, maybe the issue is just a human resources one, and the particular bad apples who work there need to be terminated, and they need to bring in new good ones.
We're going to have to take another short break. That's a nice statement. When we come back, though, I'd like to know where you're wanting to go with this investigation. I know this is ongoing. And I'd also like to touch on the other state-run facility that's under the microscope right now. So, facts, stay with us.
She passed away about 6 months ago. Sure, yeah, they missed their mom. It was hard to learn that there was no cure. You don't want to see somebody that you love suffer. So we sought hospice care. Hospice people made her feel comfortable and pain-free. At first, the girls didn't know what was going on. The girls knew that Mommy was sick, that Mommy wasn't feeling well, but they didn't know that Mommy was going to die. I don't always have the answers, the best answers to the questions that they're going to ask about what's going on. And often the hospice people would be there. And they helped, they helped me and the girls through just an incredibly hard time.
At what age is the color that your skin was meant to be no longer beautiful? Every year, millions of young women try to change the skin they were born with and say they die for darker skin. Sadly, some actually do. Melanoma is the second most common cancer in teens and young adults, and one person dies from melanoma every hour. Change your thinking, not your skin. Stop tanning. Learn more at spotskincancer.org. A message from the American Academy of Dermatology.
3 minutes. Welcome back. We are running out of time and there's still so much to talk about. I wanted to touch briefly on, we've got about 3.5 minutes left, briefly on the other state-run facility that is under the microscope right now. And kind of, what is it saying about our facility?
Even now, as we speak, University Medical Center's ER has had to deal with a new influx of mentally disturbed people coming into their ER because Ross and Neal, the state mental hospital, is now having to really watch what its intake is because they are paying extra special attention on what their people coming in and out. So now they are having to put people now at University Medical Center. So it's a pressing issue right now where we literally are running out of room of where to put the mentally disturbed that, police officers, they bring them in many times from the streets. And it gets to a situation where it's just this revolving door. And that's where the allegations are coming in. So far, admittedly, 10 patients that were sent by bus without chaperones. And it's getting to a situation of, whereas right now you're hearing there's thousands of people sent out across the state across the country with nobody to pick them up. So far, to put it in context, most of the overwhelming majority of those people were sent to family members and they picked them up there.
We're talking like 99%.
Correct.
Okay.
10 people so far, according to the investigation, were sent and there were no family members to meet them there. That's still 10 people, and that's what the state of Nevada so far had their internal investigation come up with. But it's a situation where right now it's causing Nevada some national embarrassment because it looks like, we're just shoving off thousands of people. That's what the headlines are coming out across the nation. But it still brings out a situation of what do we do with these people, especially whenever we aren't spending the resources to be able to take care of them long term. Nevada is obviously, a state that brings in, people are coming in from all across the country. What do we do whenever they end up having some sort of mental episode here in Nevada? And sometimes we try to bounce them right back.
Do you think the numbers are just really increasing right now? I mean, we have a number of facilities. They all seem to be very crowded. Does it seem like the numbers are just increasing, or is there a legitimate need for new facilities to be built? We have about a minute left.
That is a difficult question to answer because I think I have not seen enough numbers to find out exactly what the level of need is, how much it's going up. I have not seen those numbers, only anecdotally. But when it comes down to it, we have to start wondering, we as a state, in a sense, do we get what we pay for? We've always kind of, seen ourselves as a low tax state. And that's, fine in many aspects. That's who we are as Nevadans. But many times it can mean low services. We can increase efficiency as much as possible on services. And whether or not that's been done yet, that is highly debatable. But when it comes down to it, there are some times where we just do not have the money to be able to take care of these people. And so we basically send them off.
Turn out to be a money issue after all. And at the end of it, we have to take another short break. Maybe we'll catch you on the other side of it. Stay with us. We'll be right back.
Winston, just one more inning, Grandma.
Ever notice how many things today kids can do without actually moving? A whole lot of things their parents used to do the hard way. So many kids' activities today seem to leave out the activity part, which makes exercise even more important for children. In fact, new research tells us the best time to enhance bone development is during childhood and adolescence. And just getting children to walk an extra 35 minutes a day could spare them the pain of thinning bones later in life. Healthy bones come from healthy habits. Encourage your kids to get up, get out, and get moving.
Hello. Hey, Grandma, how about another grape soda?
A public service message on building strong bones for kids from the Pediatric Orthopedic Society of North America and the American Academy of Orthopedic Surgeons.
At what age is the color that your skin was meant to be no longer beautiful? Every year, millions of young women try to change the skin they were born with and say they die for darker skin. Sadly, some actually do. Melanoma is the second most common cancer in teens and young adults, and one person dies from melanoma every hour. Change your thinking, not your skin. Stop tanning. Learn more at spotskincancer.org. A message from the American Academy of Dermatology.
Welcome back. Ryan just asked the question that we all would like to know, but there is no answer for. What is the solution to this? And I think we'll just follow the investigation.
I mean, the honest truth right now is just we need more information. We need more investigation. We need more independent investigation because there are just too many questions out there to find out exactly whether or not it's an issue of raising taxes, whether or not it's a matter of efficiency, whether or not it's a matter of just like if we try to get all those bad apples out of the system. That's the status quo answer right now, and that's what's being done by Governor Sandoval.
That's where we're going to have to leave it. Hope you guys will join us next week. We're going to be talking about the impact of the Boston Marathon bombings, and we'll also be discussing viewer email that we had that was very thought-provoking. So Nathan, thank you so much
My pleasure.
for coming to the show today. For all of us here at The Scramble, thank you so much for joining us, and we hope to see you next week.